Welcome back. Look, the heat outside can be dangerous for anyone at any age, but the elderly are extremely susceptible to the hot temperatures we've seen lately. And there's a community that recently opened that our next guest says can keep your loved ones cool and comfortable. Joining me now is Kimberly Crawford-Stokes. She's a sales director over at Anthem Lakes Senior Living and Memory Care. Good to see you.
Thank you.
So we're talking about heat and things people need to be aware of.
Yes.
But first, talk about some of the dangers of overheating with the elderly.
Well, overheating can cause a lot of health concerns with seniors. Number one, always thinking heat stroke is the biggest concern is a bit of a misconception, because if a senior has to go to the hospital, receive medical attention, what we don't want to happen is, as a result of being in the hospital, they become more dehydrated, more lethargic. They're not exercising, so then their muscles are not being used. So we all know if you don't use those muscles,
you lose them.
Exactly. So being hydrated and being mindful of the effects that the heat can have on you as being a little bit older is very important.
Well, yeah, I mean, you have to stay hydrated, and obviously the more you drink, the more you gotta go to the bathroom. A lot of people like say, I don't want to go to the bathroom much, so don't drink the water, and then you get overheated.
Well, that is a misconception. If your body needs it, the hydration, your body is going to absorb what the body needs, and what the body doesn't need, the body will expel, i.e. waste. So if your body is thirsty, your body will suck all of that up like a sponge, and then whatever it doesn't need, it'll wring out.
And let's talk about some of the factors that put seniors at a higher risk.
Okay, well, we all know that sometimes you walk into your grandmother, or you walk into a friend's apartment just going to drop something off, and you're like, okay, it's 95 outside. Why is it 95 in here?
Right, right.
So having an apartment that's kind of hot, also sometimes because the blood in someone that's a bit older is a bit thin, so they do have to layer a little bit more, so that does aid in the cause of dehydration and also heat exhaustion, because then they go outside and they have all of these clothing on because they're preparing for when they walk into a building that has all of this air conditioning. Those things do affect them as well.
And let's talk about what you guys do at Anthem Lakes as far as to teach your caregivers, the seniors, and anybody else watching now too, the signs, like the things to look for. Know the signs.
Of course, if someone is not behaving like themselves, number one. Number two, if they're a bit disoriented, maybe not walking in a straight line, maybe a little fatigued, appetite is gone. Also, if you notice that their hands are a bit clammy, or maybe they're not able to grip or grasp something that normally they would be able to. Those are immediate signs. It's not mom, dad, grandma, or uncle is tired. Those are signs that something may be wrong and it deserves immediate attention.
And you guys, obviously at Anthem Lakes, you have people there monitoring it and with the residents. But folks, if they're not there, they're at home, they need to be cognizant of this and visit, and see these things and pay attention to these things when they're visiting.
Yes, yes. Observation, you always want to err on the side of caution and rather be safe than sorry. So if you're walking in and you notice it's a bit warm and they may not like the air conditioning, check the thermostat and make sure that it's not turned off. You can turn it up and maybe figure out how to lock it, be a little bit comfortable. Also, if they prefer not to have the air conditioning on, just make sure that the blinds are closed, and maybe have one of the curtains that blocks out the sun, and maybe even suggest that the senior, watch TV in a different room when it's peak, excuse me, peak heat hours. Yeah. Things like that. Also, have them hydrate, drink water, not just water, juice, eat watermelon, cucumbers,
water,
things that have hydration in them, and also be mindful of how much coffee and tea that they are drinking.
Caffeine's a dehydrator.
It is, so be mindful of that. Try to limit it to 1 cup.
Great tips. Appreciate it.
Yeah.
And we want to thank Anthem Lakes for making this segment possible. For more information, you can visit anthemlakes.com or call 904-583-5399, and you can also find them on Instagram at Anthem Lakes.